The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guest or host are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Hello and welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. I'm your host, Dr. Paul Hrkal. This show is all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. We are going to feature some very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to lead their best lives naturally. This episode of Supplementing Health is brought to you by AOR's Curcumin Ultra. This premium formula combines free-form curcumin in the form of curcufen plus the water-soluble parts of turmeric in the form of termicin for unparalleled effectiveness and bioavailability. This combo of well-researched extracts provides fast-acting and long-lasting relief from pain and inflammation. Look for Curcumin Ultra today at your local retailer or at aor.ca or aor.us. Hello and welcome back to Supplementing Health. I'm your host, Dr. Paul Hrkal. Today I'm really excited to be here with a friend, a colleague, and somebody that really is going to give us a lot of insight into the world of complementary and integrative cancer care. So I'm here with Dr. Mark Fontes, and before I throw it over to him, you should know that I went to school with Dr. Fontes and we were classmates. So I know him quite well, and he's really been somebody that has done a phenomenal job for our profession as naturopathic doctors, and really for his really caring attitude with patients. So Dr. Fontes, thank you so much for being on Supplementing Health.
Thank you for having me. Looking forward to this conversation.
Okay, so just by way of introduction, why don't you tell us a little bit about yourself, because you're really involved with not just your patients, but also you are part of the faculty at the Canadian College of Naturopathic Medicine, which is the accredited naturopathic college here in Toronto, as well as you're part of the Canadian National Naturopathic Association, the CAND. So why don't you tell us a little bit about how you balance all these different things which you're doing?
Yeah, thank you, Paul. And I think all of it for me really comes from a place of passion to do all that work. So yes, primarily my work is in clinic as a naturopathic doctor, where our clinical focus is in supportive cancer care, and that includes seeing people from prevention through to supporting them through treatment, afterwards into prevention. I'm also I love supporting the profession and growing the profession. So as of last year, I stepped into the role as chair of our national association and really enjoying that work. And also in contact with students at the Naturopathic College and supervise a shift there once per week.
That's great, Mark. Really, again, a big thank you from us, definitely from AOR and from myself. Just very impressive. We need, dedicated, caring clinicians such as yourself, and I think there couldn't be a better area that you are focused in when it comes to cancer. So let's dive into the topic.
All right.
The first place to start, and I've done some work in complementary cancer care myself, but even in the last 2 minutes we started talking, I refer to kind of the natural approach to cancer care as integrative, complementary. You could throw in alternative in there. You can throw in natural, naturopathic. What do all these terms mean? Are they meaning all the same thing? Because I think there's a confusion both even on, definitely on the patient side of things, but also on our kind of conventional colleagues, oncologists. They sometimes don't know what to make of it when we actually use different words.
Absolutely. And I'm glad you brought that up. You'll see all these terms utilized online. And at the end of the day, it is a source of confusion amongst patients and oncologists and other medical doctors. we really strive for the terms as naturopathic doctors in this area with complementary, supportive, and integrative care. When we look at the term alternative, it does mean that the patient is seeking out some type of treatment in replacement of what their doctor might have recommended. So we really definitely push for complementary or supportive care, that is attempting to augment what the patient has chosen to do from a conventional perspective with their medical team in order to allow the medications to work better, to reduce side effects, and later on to aid in the prevention of recurrence. The term integrated then gets thrown around, but the way I sort of perceive that terminology is if the naturopathic side of things and the conventional side of things is provided by the same person or in the same center, let's say. And that's still an area that I think we need to work towards, is providing these two cares in the same place, ultimately, for patients to make it easier and more accessible. As you know, in our private practices, myself and yourself included, patients are seeing their doctors in the hospital, and then they come to see us in our own private practice. So that's more of the complementary or supportive care versus I view integrative, meaning it's a more streamlined, coordinated approach for care for patients.
It gives the people the perspective or perception, at least, that we're truly working together. Where, exactly. When you're under the same roof, you could be integrative, but not necessarily. And right. I find that is probably, especially in cancer, one of the most confusing things for patients. And if you just think of how a person that just had a diagnosis that is quite shocking, this is not the diagnosis of pneumonia, it's a diagnosis of something that typically is associated with a lot of negative emotion, then they're now trying to figure out what the best course of action is. And so I see patients all the time just being like, so should I do this along with what my oncologist is saying? So maybe just speak to that a little bit about, how you're finding working together and what the best type of setup that way is.
Absolutely. And it's, at the end of the day, it's those types of things that leave more work for the patient to do. It leaves them more stressed to sort of figure this part out. So I think as naturopathic doctors in this area to take that work and not allow the patient to sort of be stuck in the middle to figure this out. So when patients ask that question, I view it as our duty to, let's reach out to the medical team, to the oncologist, the radiation oncologist, and discuss, how can we work together here? This is obviously an interest for the patient. There's evidence behind the things that we can do, and here's our specific role in the care of the patient, acknowledging that we're here working together, that there is no alternative treatments, but we're here working together in the best interest of the patient. So it comes back down to communication, that information needs to be shared both ways. And definitely my experience, as you start repeating that, then the relationship starts to build and confidence starts to build amongst the MD and the ND to coordinate a targeted, streamlined, and feasible approach for patients for their care.
Yeah, I think you've touched on a lot of great points there that are worth unpacking even more. A lot, like if you're talking to just the general person about what you do, and you have a very strong focus in cancer, it's something important to understand that you've actually gone well above and beyond to get trained in treating and managing cancer from a natural perspective. There's this certification with the kind of the FABNO. Maybe you can say a little bit about that, because that, I think, really gives someone like yourself a lot more credibility to be sitting at the table and working in hand with some of these oncologists.
Yeah, thanks for mentioning that. And it comes from an organization in the US. They're called the ANP, or the Oncology Association of Naturopathic Physicians. And they have since created a fellowship, a fellow of the American Board of Naturopathic Oncology, where you can apply to receive that designation after a certain number of years in practice, after seeing a certain number of patients in cancer care, and then writing an examination to achieve that standard. So yes, thankfully I've achieved that designation, and it does, we do see more patients looking for that designation and inquiring what that's all about. And ultimately what it does show is that extra training in supportive cancer care treatments.
Yeah, that makes a big difference in terms of creating that, again, that further rapport and relationships.
Mm-hmm.
Are there, you see obviously a lot of cancer patients in all walks of life, in terms of prevention, in terms of, stage 4 cancer, and they've been told that they don't have anything else to go or do, and then ones that have been just recently diagnosed. Mark, what do you find the most kind of commonly asked questions that people will ask you in the first couple visits when you're seeing them?
Yeah, I think the most common questions I'd say would be, as we touched upon already, can we integrate what we're talking about with what we're doing in the hospital? That's by far, I'd say, one of the most common questions, and that a bulk of the work we do in the first few visits is, again, building that relationship from their doctor's side of things so that we can start sharing information and research and building a plan together. Another common question we hear is, even though we're seeing, obviously, patients are coming in for the first visit and they've sort of bought into that, but still is, what is the role of us as naturopathic doctors, naturopathic medicine in their care? I think, patients come with a certain idea of what to expect around supporting them, maybe looking at blood work, allowing, supporting their energy and their immune system, but there's so much more that we can provide. So I think just a general question around what can you do for me and my health in our time together?
Yeah, for sure. And you've talked about that relationship with that oncologist. Speaking to that relationship, how are you finding the reception of the conventional side of things to natural treatments? Because the facts are that, almost 70-80% of people in general are on a natural health product of some sort.
Right.
How powerful diets are, whether they're fat or not is a different story, whether they're effective or not is a different story. But people are being very receptive to natural therapies in general and natural remedies. And it's just a matter of time, or it's a matter of necessity that an oncologist or a family doctor or anybody that's dealing with a health issue has to understand that this is part of a patient's life. How are you finding that your reception is with some of those oncologists now?
Over time, for sure, I'd say it's generally becoming more positive, but it's that piece around when we're able to effectively communicate. So a lot of times it's sending over a fax, a letter describing, I met with your patient today and here's what we discussed and here's our goals, and hopefully hearing back. But when I've been able to have, whether it be a face-to-face conversation or even over the phone, that by far has been a lot more successful. And just having that time and breaking down misconceptions, I think, of who naturopathic doctors are and the care we provide. Again, that comes back to the terminology we discussed in the beginning around alternative and complementary and natural, and where do we fit in. And a lot of times it is misconceptions around who the docs think that the patient is seeing. And so when possible, it's striving for that face-to-face or over the phone few-minute conversation, and then sharing research behind everything that we're doing to state that, there's literature behind what we're recommending, and now let's just make it work the best way possible for our patient. So there's still roadblocks for sure, just from the inherent nature of the difficulty in communicating amongst practitioners.
And the fact that we're not actually in the same system, like we are in the same province, we have similar regulations, but we're not actually in the same hospital. And, I think that there is a standard of care, and that standard of care does not include natural medicine or naturopathic medicine yet, right? And so ideally, there are places around the world that it does include that. And that would be, I think, would you not agree that would be the best case scenario?
Absolutely. If we get to that place where it makes that roadblock of communication easier in some way. And, I always stress to patients that, everyone on your team here has your health at the top of mind and as their goal. How we can achieve, I think, better health and overall outcomes is, again, coming back down to achieving better communication and sharing information. But definitely, if there was a place to aim of allowing MDs, NDs, nurses, et cetera, working in some kind of collaborative system where communication can be shared more easily, it would greatly help this whole process along. And I remember speaking with an oncologist at one of the hospitals here in Toronto and saying that it also follows in our profession too, where we commonly send out release of records to medical doctors or oncologists. Can you send me the last blood work the patient did so we can take a look at it and update our medical records? And her feedback was a lot of times they don't hear back from the naturopathic doctor. So I thought that was really interesting feedback there that, we're requesting all this information, but a lot of times we don't share it back. And in this case, she wanted to know the information. What are you doing? What additional blood work did you run? And not from a place of judgment, from a place of understanding and learning more and seeing how it fits into the patient plan. So whenever I'm speaking with colleagues, it's got to be both ways, and we have to share just as much as we're asking for information.
Yeah, that's an excellent point. There definitely is a bit of a woe was me mentality on the naturopathic profession when it comes to the relationships you just talked about with the conventional medicine. But then when there are the few that may be open-minded, which now are becoming more and more, the ND sometimes doesn't follow up to actually foster that relationship. Or I guess that the idea of just like, when you hit 5 roadblocks, the 6th one, you're just going to assume it's the same thing, but not always the case. And that's what you're talking about, is changing, right?
Exactly.
So you mentioned the combination, so the complementary cancer care or the integrative cancer care. But let's speak to, a common question that a lot of patients have asked me in the past is, okay, so you're saying that there are things you can do with chemotherapy and radiation, but my oncologist or my pharmacist says don't do anything natural. How do you respond to that? Because those seem to be two polar opposites, and unfortunately the patient often gets caught in the middle in that.
Absolutely. And it's a very common topic, especially when a patient is about to start treatment or in the middle of chemotherapy treatment. In those cases is where immediately I'll attempt to communicate with the pharmacist, or most typically the pharmacist who's checking for a lot of times for these interactions. And I'll look into that interaction as well to see, okay, what came up on their side of things, and what's the evidence there behind it. And ultimately also speaking to the patient around if it is a study perhaps that was in a cell study or an animal study, but when we've used it clinically with patients, we've never seen any negative side effects. And importantly, our role as naturopathic doctors is understanding, why are we prescribing something and how are we going to monitor it? So, if we're giving vitamin D to help with the immune side of things and also increase their blood levels, well, we should be checking their blood levels of vitamin D and their blood counts to make sure it's doing what we're expecting it to do. And it's one way that we can start to monitor safety and efficacy of the things that we're doing. So in those conversations, I'll speak about that. Sure, this study may have showed this negative impact or maybe no impact, but here's how I've used it clinically, and here's how we're monitoring it to see if it works for the patient the way that we'd like it to.
And that's so important, to be able to prove something that you're recommending and prescribing. I find sometimes the naturopathic or natural approach has to be even more rigorous in some of the research behind it, because they've had to prove it so many times, quote unquote, or they've had to explain it so many times. And I'm finding that more and more pharmacists and oncologists are getting at least a little bit more open-minded. But there are still some that will say, absolutely not. And I think fundamentally, especially when it comes to chemotherapy and radiation, there's this idea that, chemotherapy, and it's a bit of an outdated idea, but, since chemotherapy has its anti-cancer effect by destroying cells or having a pro-oxidant effect, the obviously intuitive opposite is anything with an antioxidant effect will have a detrimental or a chemo blocking idea. Maybe speak to that a little bit, because I hear that all the time.
Yeah, and it's still such an area of debate. And there was a recent study just a couple of weeks ago where some studies showing, common antioxidants may have an interaction with chemotherapy, others showing a positive association between the two. But it's still, I think, going back to we're not approaching this as like population medicine, like not vitamin C for all or coenzyme Q10 for all. But if we are thinking about it for a patient case, say during treatment, why are we prescribing it? What are the benefits? What are the possible risks? Does the benefit outweigh any theoretical risk? And again, how do we monitor this for patients when we are prescribing something for them? For example, if a patient's undergoing a certain chemotherapy medication that could be impacting their heart function, and the docs might be thinking about reducing the dose or extending the time between treatments, is there a role for, let's say, an antioxidant like coenzyme Q10 to help start supporting their heart function in order to receive the treatment that they're getting there in the hospital? So
Yeah, exactly.
and then of course, as you know, we'll always then start to look into the half-lives of things. So with the treatment, we can also keep certain recommendations we're thinking about a certain timeline away from the chemotherapy medication to really minimize the risk of any interaction. So a lot of times we do that for people where if they're receiving treatment, let's say every 3 weeks, we can give certain supplements at specific timeline in between treatment, thereby negating any theoretical interaction that there might be.
Yeah. Again, I think that's an amazing point that you brought up, Mark, because it's not just about we are trying to do the same thing chemo or radiation is doing. I think there are many times that we're considering maybe other things that may be a side effect of the chemo and radiation, right. And we're minimizing those things. Like after radiation, one of the common side effects is fatigue, and right. That often happens even weeks after the radiation's been completed. And so there are a number of herbs that have been studied to help improve that and reduce some of those feelings, even though that's not being directly anti-cancer. It's just helping the person's quality of life.
That's right, so which is so important. Yeah,
it is, and unfortunately often overlooked in the conventional side of things, where it's kind of like, well, we're just here's the treatment, everyone gets more or less the same thing, provided they can handle the toxicity, and hopefully you tolerate it.
Right.
Okay, so another common question, and we're kind of rapid firing through some of these because I think it's so important that we highlight some of the questions that people have. Is you hear about a lot of these miracle cures, a lot of these miracle diets, the Gerson protocol, the Gerson diet, Budwig diets, these clinics from around the world. Mexico is kind of famous for them, because there really isn't a lot of regulatory oversight in Mexico. What has been your experience with some of these, I'm going to use the destination treatments or these kind of more hardcore natural treatments in general? Because I'm sure you've probably come across a lot of patients that have tried some of these. And there was that documentary, Truth About Cancer, a couple of years ago that really highlighted a lot of these. And we can talk a little bit about that documentary itself, but I found, it definitely painted them in a very positive light, and that it was, a cure-all in some senses, or at least that's the sense patients get.
Yeah, and of course, in that situation, when they're, some people presented with these chemotherapy treatment options, and start to look, okay, what else is out there that might not be as with as many side effects I could experience. And I think that's another role for us there, is to look at that individual case and patient around what is their diagnosis and what have studies shown to be the benefit in doing chemotherapy and in preventing recurrence and in 5-year overall survival rates, and certainly some types of cancers being significantly better than others and the types of treatment that they're undergoing. So I have a very upfront conversation with people around this is what we're looking at from the conventional side of things. And in some cases, like a lady I saw recently, it was the discussion around you need to do chemotherapy because it's over 90% response rate and greater 95% chance of being disease-free at 5 years. And unfortunately, nothing that I could discuss, or I think these other clinics can state, would be that profound in terms of a statistic like that.
Right. And that's just shocking thing that you just said, because you'd think, and again, this goes into kind of some of the thoughts, the preconceptions that people have, is they're like, well, hold on, a naturopath is recommending chemotherapy. That's blasphemous.
Right.
They should never do that. I've had a couple conversations with patients as well, and they've decided to, go do the surgery or right. do a therapy. And I think the point you're trying to make is I think a good clinician, period, whether it's medical or naturopathic or whoever should just recommend the most evidence-based treatment, period, no matter what.
That's right. And it's a huge burden on our shoulders to ensure that we understand the information correctly. And a lot of times, patients will then have a little more time to decompress after the visit with their oncologist. I'll sit down and show them these studies that are out there and make sense of it all. And thankfully, with the time that we have with new patients, that we see to go over all this information. But it's specifically with the clinics that are, we've had patients go to Europe, to the States, to Mexico. And definitely the protocols, from as far as I'm aware, there are consistently changing. So what we'll do typically with patients is, ask them to contact the clinic, or we'll contact or reach out as well too, to see what's happening, what's the proposed plan, and the cost as well too, because as you know, unfortunately the cost of these clinics are also incredibly high.
Very expensive.
And what is their goal? For some clinics, it might be a one-time treatment. For other clinics, they recommend you have to come back every 3 or 6 months. And so just from a financial perspective and time commitment, it's to talk to patients about that. We've had patients go after treatment that they've received here. And I've heard good feedback from patients as well too. Like they've gone to clinics in Germany as more of a rehabilitation and supportive sort of protocol after treatment to build them back up again. And we've heard good feedback from that specifically.
And that's another thing to consider, is that some patients choose to start employing some of these naturopathic, natural strategies after they've gone through their conventional care. So there is less overlap. They feel more comfortable in their mind. I mean, that's another option for some people. So there are so many different ways to approach it. Like I've had patients that have just said, I just want dietary support. And that's a huge part of what any sort of good, natural approach should take is, food first. Talk about your sleep, talk about exercise.
That's right.
Before you get into, very specific extracts, which, they're very exciting. And there's some really promising things. You mentioned a couple of them. I think that's a great little segue into, every case is obviously different, but what do you think that every person that either has cancer or, a family member that might be listening, or maybe even the future, what are top 5, natural therapies that people should at least be aware of and what they specifically are good for?
Sure. Yeah. So supplements specifically?
It could be anything. It could be something as simple as a way of eating. It could be a specific nutrient, like you mentioned vitamin D, because in part 2 of our episode here, we're going to dive into some of those things in a lot more detail. But I kind of wanted to give people a little bit of a flavor of some of the things we're going to be discussing, because that is where so much questions that people have center around, is being like, oh, you know what, I heard that green tea is the best thing for cancer. And, of course, that's a loaded question. And there is good research on green tea in certain cases, but I just wanted your take on, maybe, 3 to 5 things that, everyone should have on their radar, and some of the things that they're actually useful for.
Absolutely. So I think you touched upon it there already, but the importance of sleep is incredibly crucial. There was a talk last year at that oncology care conference from a researcher out of Harvard, just speaking about the importance of sleep. And that it's a cornerstone of what we all, I think, as naturopathic doctors, focus on and treat with patients. It's a time when we know that the body heals, when our immune system rests and recovers as well too. It's with better sleep and regulated sleep, there's less inflammation in the body, and we know that being inflamed or higher inflammatory markers in the body is a potential precursor and risk to the development of cancer and recurrence potentially. So it really starts from there. Secondly, from a dietary perspective, we look at these concepts of intermittent fasting in a variety of different ways, and overall fasting as well too, in and around chemotherapy treatments. The work from Dr. Walter Longo in the U.S., and he's from Italy.
Yeah.
How it might reduce side effects associated with chemotherapy treatment. So
fascinating, isn't it? Just how it's counterintuitive that you decrease the amount of calories, and the body goes into this like protective mode where it becomes more resistant to chemotherapy and radiation. At least the healthy cells do, but cancer cells lose the ability to self-regulate. That's one of the characteristics of cancer cells. and they are not, they are more susceptible, or at least regularly susceptible. So that's just so brilliant, isn't it?
It's so interesting. And for all listeners out there, I definitely recommend, if you're interested in that, to look up Walter Longo's work and see what he has to say there. And hopefully we can discuss more about that in our upcoming podcast. Additionally, I spoke about it, and you mentioned it again around vitamin D. The research just keeps on growing of the importance of vitamin D. And what I tell patients is that as Canadians, especially, I think it's one of the most modifiable risk factors that we can look at and treat to support healthy vitamin D levels, to get them into the proper range, because we know vitamin D is anti-inflammatory. It's an immune supportive agent. It helps with bone health overall. So the variety of outcomes that are really important with a relatively cost-effective intervention.
Especially, as you said, Canadians, like, it's a massive issue. I run vitamin D levels on almost all my patients, and most of them are borderline, insufficient. Some of them are totally deficient. And those often people, the ones that are totally deficient, are usually the sickest because they have problems absorbing it. If you're taking it, there isn't really a good dietary source of vitamin D. You have to get it through the sun. And during the, 3 seasons in Canada, at least, we're not outside in a shorts and t-shirt, which is really what you need to get some good vitamin D being made, right? So
absolutely.
You're right. It's something so simple that can be tested and then modified. What about, give me one herbal substance or extract that you're really excited about that we'll talk more about in the next episode?
The main herb I'm excited about is boswellia or frankincense. I think the research is going to continue to grow with it, and there's been newer studies with it, which we'll talk about in our next podcast, around its profound anti-inflammatory effects, but also helping reduce inflammation or edema in the brain after patients who receive radiation, certain chemotherapy medications as well, too, to improve quality of life, to reduce certain side effects, and to aid in healing post those treatments.
Yeah, I'm a huge fan of boswellia too, and that is one of many. Curcumin, green tea. These are a lot of things that even conventional oncologists are starting to get familiar with, and probably because they've been asked so many times about them. But it's a very common, very well-studied substance. And so, Dr. Fontes, thank you so much for sharing about just getting people comfortable with the terms around oncology. We talked about some of the misconceptions about relationships and the improvements, actually, of relationship between naturopathic care and conventional oncology. And hopefully our listeners are a little bit more comfortable with the concept of combining the two, and there is a balancing act of getting the best of both worlds, right?
Absolutely. Yeah.
Awesome. Thank you so much. Yeah, no problem. We're going to chat with you very shortly again for part 2 of this. So fascinating, and learning all about what's coming up in natural cancer care. Thank you so much for joining us, everyone that's listening. We look forward to our next episode with Dr. Fontes, and we'll catch up with you then.
Thank you for listening today. For more information about our guests, past shows, and future topics, please visit aor.ca/podcasts. Do you have a topic that you want us to cover? We invite you to engage with us on social media to request a future topic, or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.